Welcome to The Explainer. Today we're digging into a powerful new report from the National Academies, and it uncovers a really startling truth. The leading cause of death inside America's prisons and jails, well, it's not what you probably think it is.
So let's just start with a quick question. When you think about people dying while in custody, what's the first image that pops into your head? For a lot of us, it's probably something pretty specific.
Right. Most people's minds go straight to violence, maybe fights between inmates or altercations with guards. But the reality, according to the data, is something far more common, a lot quieter, and, tragically, often far more preventable. I mean, get this. The sheer scale of it is just staggering. A full 87% of all reported deaths in state prisons are due to illness. Not violence, not accidents, illness. That one number completely reframes this entire conversation. So why? Why is illness so deadly behind bars? The report shows it's kind of like a powder keg. And the problem doesn't actually start with the conditions inside the prison, it starts with the health of the people who are entering it in the first place. And this really gets to the core of the issue. The population inside our prisons and jails isn't just a random slice of society. On average, these folks carry a much, much higher burden of chronic disease, mental health struggles, and substance use issues before they even walk through the gates. And to really understand this, just look at these numbers. The data shows that 40% of people in state prisons have a chronic condition like diabetes. Another 37% have been diagnosed with a mental health disorder. And this one is just huge. A staggering 65% have an active substance use disorder. So this is the baseline health profile the system is supposed to manage. Now, here's where things get really tense. The U.S. Constitution actually guarantees incarcerated people a right to adequate health care. The government can't be deliberately indifferent to their serious medical needs. But the reality on the ground, well, it tells a very different story. The National Academy's report really groups the reasons for this gap between a right and the reality, into four main themes. And when you put them together, they create a perfect storm that leads to these systemic failures in care. Let's walk through them.
So first up is funding. Unlike the healthcare you and I get, which is usually paid for by insurance, carceral care is funded directly by government budgets. So when those budgets get tight, healthcare is often one of the first things to get squeezed. And that leads to staff shortages and a breakdown in care, especially in smaller, more rural facilities.
Okay, so to try and get a handle on these spiraling costs, a lot of prisons and jails turn to private, for-profit companies to provide health care. But as the report points out, this brings in a whole new set of complications and, potential conflicts. And a Reuters investigation really highlights the potential consequences here. Between 2016 and 2018, jails that contracted with major private healthcare providers had significantly higher death rates. We're talking 17 deaths per 10,000 inmates, compared to 13 in the facilities that were run publicly. And this really points to a potential conflict of interest, right? The report notes that a for-profit model creates incentives to cut costs, which can directly clash with the medical needs and the well-being of the very people they're being paid to treat. So, what happens when this extremely vulnerable population crashes into this deeply strained system? Well, the consequences are tragic. And as the data makes painfully clear, they're often entirely preventable. This timeline is just devastating. Between 2001 and 2019, the number of suicides in prisons jumped by 83%. And even more shocking, from 2001 to 2018, deaths from drug and alcohol overdoses skyrocketed by over 600%. These aren't small changes, they are full-blown crises. And then there's another killer that often goes completely unnamed: withdrawal. People can and absolutely do die from the severe physical stress of withdrawing from substances like alcohol and opioids. But these deaths often get misclassified. And even worse, there's no national system for tracking them. We literally don't know the true scale of this problem. Behind all these statistics are individual stories that just show the human cost. Take the case of Dana Huff. He complained for months about a lump on his cheek, but staff just kept dismissing it. By the time he finally saw a specialist, it was a massive, inoperable cancerous tumor that had already spread through his skull. And on top of all of this, the official numbers we do have might actually be an undercount. The report points out this practice where terminally ill people are released just before they die. Now, this not only shifts the huge cost of end-of-life care, it also means their deaths don't get officially recorded as happening in custody. And all of this brings us to what might be the single biggest obstacle to fixing this crisis. It's not just that the system is broken, it's that the system is incredibly difficult to even see into. You see, the report concludes that getting to the truth is often blocked by a wall of silence. Investigators struggle just to get access to facilities. There are no universal mandatory reporting rules for every single death. Medical records can be nearly impossible to get, and cooperation from staff, not always guaranteed. This leads to a really simple but critical conclusion. A system that can't be seen can't be fixed. Without transparent, comprehensive data, it is nearly impossible to learn from these tragedies and stop them from happening over and over again. And that really leaves us with a final, vital question that this report forces us to confront. It's a question about accountability, about transparency, and really about the fundamental value we place on the health and lives of every single person in our care.